Hi everybody, this is Dr. Zapczynski. We're going to talk about the professional resume. The resume is a formal document created by the job applicant to itemize their qualifications for position. It's usually accompanied by a cover letter that expresses the interest in a specific job and draws attention to important parts of the resume. This is your introduction to prospective employers. The terms resume and CV are often interchanged as if they're the same thing. The difference between the documents is the job candidate's intent. Curriculum vitae means course of life. It emphasizes academic accomplishments, research papers, presentations, scholarly work that is important when persons applying for academic positions, fellowships, and grants. The resume is used when you're applying for an industry or private sector job, such as in healthcare. The resume highlights education, licensure, accreditation, certifications, experience, skills, your professional memberships, and scholarly works, such as the paper in lieu of thesis. The resume begins with a cover letter. The cover letter introduces you to an employer through a personalized explanation of your qualifications and interest in the position. The resume will share your technical details of work and your work experience, your skills, but a cover letter gives insight into your soft skills, your attitudes, your motivations. Employers use cover letters to kind of get a sense of how well each candidate would fit in with their company culture and use their experience to accomplish the requirements of the position. Strong cover letters provide a clear connection between your goals and the company's values. So here are the parts of the cover letter. All cover letters start with a header that includes all of your contact information. You can center that and then add the date. Second is the name and the address of the person who's doing the hiring, whether that's the physician or a hiring manager, followed by the greeting, dear whomever. The first paragraph of the cover letter should provide the basic details about who you are and why you want the job. Include the title of the job you are applying for, and provide a general overview of why you would excel at the position and the reasons you're excited about the job. You can mention that you heard about the position from another person, and that's a terrific strategy if another employee referred you to the position. The next paragraph should demonstrate that you understand the company's mission and have done some research into the position. This shows them that you're interested. Focus on how your goals align with their goals and connect to the elements you like about that company. In closing, thank the person for taking time to review your application and then express your interest in discussing the position and scheduling an interview. Then, your signature. Sign off, sincerely, best regards, respectfully, yours truly, and then your name and credentials. The resume will have the same header, your contact information, as the cover letter, but without a date. The professional profile is actually the objective. Summarize and explain the value you will add to the practice. Briefly, remember that people who are reading resumes are busy. If it's too long, they may pitch it in the trash. They want to see what you have to offer quickly and concisely. You're going to start with your education, nursing only. Write this as if you have graduated. You can add MSN, BSN, and ASN if applicable. List your licenses and certifications. Louisiana RN license. If it's multi-state, indicate that. Louisiana APRN license. Your certification and the certifying body, such as AANP or ANCC, but you're going to spell it out. And other certifications that would be helpful to have include your CPR, Include any specialties, wound care, diabetes educator, emergency room certification. Under clinical experience, this is where you're going to list your clinical experience during the MSN program. As new NPs, you have to have at least 500 hours of clinical experience in order to sit for the accrediting exams. This counts towards your experience. List your clinicals by semester starting with the final semester, which is the practicum for most students except for our psych NPs. Give the name and the city of the facility. Give the name and the credentials of your preceptor, whether they're a family nurse practitioner or a psych mental health nurse practitioner or a medical doctor or a PsyD. List the skills you learned in these semesters. Emphasize these skills. For example, acute care, placement of central lines, psychiatric mental health, counseling, crisis intervention, women's health, Implanon implantation, IUD insertion certification. Bullet points work best. The next section is your work experience. This is as a nurse. If you have been a nurse for years, you may have been employed in many settings. The last 5 to 10 years is sufficient. Highlight the most recent employment and you can summarize the rest. List the title of your position, staff nurse, supervisor, float nurse, unit manager. Give the name and the address, the city, state, of your employer. Under the job description, use words such as responsible for delivering direct care to post-op cardiac patients, or managed the day-to-day operations of a busy med-surg unit. Give the name and the title of the supervisor. List your professional memberships. Give the month and the year you joined, and if you're still a member, use current. Professional memberships convey your investment in your profession. These are some examples. Under papers and presentations, this is the APA formatting for the paper in lieu of thesis, and while your paper may not be written, you certainly know the authors, you know the date that you're going to finish, which is 2024 or whatever date, and the name of your paper. It is an unpublished paper in lieu of thesis, and the university. In summary, the resume begins with a cover letter. Then, education. Nursing licensure requires an advanced degree. Continue with licensure and certifications. Highlight your clinical experience. New graduates have experience from clinical hours. Emphasize your skills in your specific area of concentration. The resume marks your transition from an employed registered nurse to an APRN with all the responsibilities that are required and the rewards that can be gained.